like it was like reading the Bible. Oh, no, that's
blasphemy.
Hi and welcome to today's video where I've got Bunsey next to me.
Hi.
Do you want to introduce yourself and how we know each other and all of that?
So Regina and I work at the same trust where I am a Pre-Reg and Regina's a Band 6.
But today I thought I'm going to ask all these questions to Bunsey. She's got so much knowledge, but also she can help a lot in terms of pre-registration process and stuff. So I thought we'd ask some questions today. Okay, so my first question is about the Oriel process. So I get so many questions about Oriel. I was the last year to not do Oriel. So what I want you to tell me is like what the stations are, how you can prepare for it, and just any advice in general.
So the first thing about Oriel, it's multiple mini interviews. So my centre was 3 rooms. Each room you have 10 minutes, but it's divided into 5-minute slots. So there would be follow-up questions in each one, but they're kind of related sometimes. So one might be a situation to start off with, where you read a little plaque and it gives you what kind of scenario you're in. So you could be as a hospital pre-reg, you could be a community. It just gives you a kind of background, and then they'll ask you follow-up questions. Whereas the second half would be maybe relating to the first half, but it might be, tell me about a time you did X, Y, Z.
So how can you prepare for that multiple mini interview?
So I think everyone prepares in a very different way. There is a professional attributes framework where they have all these kind of ideals that a pre-reg should be. So kind of think of examples where you fit those attributes, and one example could have lots of them. So how you've worked well in a team, how you've used your initiative, how you've worked independently, but perhaps where you asked somebody senior for advice, because one of the big things is you have to know your limitations as a pre-reg pharmacist and when to ask for help.
That's like the Oriel process, right?
Yes.
Then you get ranked and then you start choosing where you want to go. And I just, like, obviously I didn't do it. So can you talk more about that process?
So preferencing, it's really important. So I think every year, the year before me, they preferenced before their interview, whereas my year, you could still preference after your interview.
Does that make a difference?
I think it does, because if you felt that your interview went really well or really badly, you could kind of change your options. However, I think it's really difficult to tell how you did. Like, you just wouldn't know. Because you think you did really badly and they're just kind of writing in front of you. You have no idea of knowing how well you did. But if you were really confident, then maybe you could start putting other places a little bit higher.
Yeah, and you mentioned about the whole preferencing in terms of certain hospitals in London. So what's your advice on that?
So I think preferencing is really, really important. Like, obviously your interview is important, but when you preference, you have to be realistic first of all, so preference a good amount, but also when you're choosing things, most people preference hospitals higher.
Yeah.
So when you're choosing your hospitals, especially in very competitive places like London, your big teaching trusts, everyone's going to put that quite high up their list. So if you, for instance, were to put it about 10th, there'd almost be no point putting it at all, because you'd have to rank very, very highly for then to get your 10th option. Mm-hmm. And that still, it just doesn't really make sense. It doesn't really add up. So if you are going to put these places that you know how competitive they are, I would say put them very high up your list. So one of the things I thought when I was preferencing, I looked at how many pre-regs there were in each trust.
Oh, I would never think about that. Really.
Yeah, so I thought that was really important to me, because I wanted more than just 2 or 3, just in case you didn't get along, or just so that you'd have more friends, basically.
Yeah.
But I didn't want to have 20 because I just felt that I'd get lost in the crowd.
Yeah.
So for me, ideally, I was like between 6 and 10 I thought was good, because you're going to have enough friends, you're going to have people that you'll get on with, and it's not too many that you're just going to get lost in the crowd and that people won't remember you.
My next question is, you've got a really good relationship with your tutor.
Yes.
And not everyone has that.
Yeah.
I know I struggled quite a bit during pre-reg, but from what I can see, you've got a really good relationship with your tutor. So how did you create that relationship, and what advice can you give to others who might not?
So my advice would be, when you first start pre-reg, it's really important that you're social, in the sense that get to know your tutor, yes, professionally, but also socially. Like, ask them about their life, because you want to be friendly. You want to be able to go to them when you need support, and if you have a bit of more of a friendly relationship, you'll feel more comfortable with them and asking them for help. When you're first getting to know your tutor, I think it's really important to be quite keen and willing to learn, because then they'll know that you're serious, that you're willing to put in the effort. So kind of be very keen and be very interested. Ask questions, because at least then they know that you're listening. Say, for instance, if you're on the ward or if you're in dispensary, wherever you are, ask questions, because then that really shows you're interested, and then they're more likely to be interested in you.
Great. So right now we are in March. Yeah. So I want to know where you are in your... Actually, this is not my question. It's from Instagram. So they asked, what current stage are you at in terms of revision, and how are you currently studying for your exam right now, if you are?
Okay, so I think everyone's at very different stages. Me personally, I'm in that bit where I'm kind of writing my notes. So I'm doing the BNF chapters, kind of going in a systematic order, going system by system, and just getting my background knowledge in. So maybe the high-risk drugs within that chapter, and for the important indications, I kind of look at the NICE guidance. So for instance, what's the NICE guidance for asthma? What's for secondary prevention following an MI? So that I'm in that stage of my revision. Some people would say that you should be starting papers a lot earlier, and I think it's really important to do one paper right at the beginning, just to know what your baseline knowledge is, not to like scare yourself, but just so you know, like, oh, actually my cardiovascular knowledge is quite good, but my respiratory knowledge is not so great. So you know what to devote more time to. Doing a paper early on would be quite helpful.
So have you just done one paper?
I've only done one paper. People are saying that I should be doing papers.
See, that's completely different advice to what I would give. But then I think everyone obviously comes from it from different...
Yeah, and that's the thing. That's one thing I find very difficult.
You said you going through the BNF is... You are capable of doing that, right?
Yeah. Some people find that very difficult.
I found that so boring.
So, like, the letters are so tiny. Yeah. It's a bit waffly.
And then it is waffly because half of it's like costs and stuff.
Yeah.
And I just think, oh my... I mean, the first part is good, but then the rest of it, it's... And I find it hard to apply that. So I think past papers now, that's how I would work. But, I mean, obviously we work very differently. Yeah. So, yeah.
So always, like, don't compare yourself to everyone else. Because I think that's what happens in Pre-Reg.
Yeah, definitely.
You're in a big group and you hear, like, oh, somebody's already on chapter 7 and you're only on chapter 2.
Yeah.
But you don't know whether they're just skimming through, or are you doing it in more detail.
I think ignore the noise and get on with your own work.
Yeah.
Like, that's so
you
important.
know how you work. You've been through 4 years at university.
That's so true.
Yeah, you know your revision style. Some people love writing mind maps. I don't like mind maps. I hate being creative. Just write it down.
Yeah, I don't have time to do a freaking bubble and like arrows and stuff.
Yeah,
no.
But some people love that stuff and they put them all around their room. Some people are visual learners, so there's loads of like YouTube videos out there. So it really depends on how you learn.
Okay. You had to prepare for interview at the same trust that you're currently working at. So you're a Pre-Reg at the trust, but you also went for the job at the trust.
Yeah.
I would find that really difficult because then I think, oh my gosh, they know me. So what I want to ask is how you just dissociated yourself from that mindset and what helped you. And
so I think there are good sides and there are downsides. So one of the good things about interviewing at the same trust you work in is that you know that panel. Yeah. It's nice going in and seeing a friendly face, especially when you're nervous. Usually your panel are very nice and very supportive. They're smiling, they want you to do well. They really are rooting for you, especially when you're at the same trust. They know who you are. You work at the trust, so you know what's coming. Like you get these emails, you know what's planned in that trust. So are they building a new unit? Are they specialists in a certain area? Are they expanding a certain area? So talk about those things and how, if you work there longer, how you could get involved and what kind of difference you could make personally to the team. So talk about your own experiences. I feel like that's an advantage. You know what it's like working there and you like it so much that you are applying there. So make sure they know that as well. Show that you're passionate and then show that you actually really want to stay.
Another question from Instagram is, does your tutor expect a lot of evidences from you? And how do you pace yourself? And my question personally is, your tutor's quite strict as well. Yeah. So you've dealt with evidence rejections when you submit the evidence and then it gets not approved. Mm-hmm. So how have you dealt with that? Just talk about like evidences in general.
Okay, so evidences are the bane of any pre-reg's life, honestly. It's long writing them, but you get used to them. So how it was very long-winded at the beginning, you realise that actually I'm waffling, or actually this maybe isn't the best, it's not very relevant. So you get a lot better at writing them. Mm-hmm. And I think if you are struggling, so some tutors actually, So some tutors prefer quality over quantity, and I know that my tutor does. So I would want to make sure that it was a very good intervention I made, and so that it's evidence worthy. So I would rather send one evidence that week, but it was a really good one, rather than sending 3 okay ones. And I think that's better because it saves you a lot of time as well, because writing 3 evidences, even if they're short, it does take time. And it is very disheartening if you think that this was evidence worthy and your tutor disagrees. But ask them why. Ask them how you could have improved. Like, why was it not evidence worthy? It might have been perfectly fine, but it was just fine.
Yeah.
And that's why it's come back to you.
Yeah.
Because they want to show how you've gone above and beyond. You should tailor your writing to the person that's reading it at the end, so you know what they want. And they say, okay, maybe you should focus on this. This is not so relevant. So I think if you are struggling, it's really important to say so. And then, rather than just making the mistakes again, know what they're looking for and then adapt.
So another question from Instagram is, how did you get summer placements, and any advice on that? And did it influence your practice today?
Yeah. So it really depends where you are in your pharmacy career. So I had 2 summer placements in hospitals, 2 different hospitals, in the end of my 3rd year, so before my 4th year. And they were great, because you get to meet the pre-regs and you get to kind of see their role. So then I knew that hospital was the one for me. Whereas if you go and realise, actually, I don't really like this, then you know, and that will influence your preferencing for Oriel. And also you get to know the people at those particular places that you've had your placement, and then you can decide, actually, I really liked it there. One of my friends did a summer placement and she ended up doing pre-reg there because she enjoyed it that much. She got to know the team. So it is really important. And if you can get it, it is great.
And so how did you plan ahead?
Yeah.
Because obviously there's not one centralized system for summer placements. It's not like Oriel, it's you applying personally. So you've got to be on top of it, right?
Yeah. So each hospital, each trust will have their own kind of form. However, a lot of them use the same basic template. So once you've done one, you kind of done them all. So one thing I did is I found the website where you can see what placements are on offer in Southeast England. Usually 3rd year students get priority.
Yeah.
So that's one thing to consider. So if you're in 1st or 2nd year, don't be disheartened. You can still apply for some of them, but don't be too disheartened if you don't get it, because they do prioritise 3rd year students. And I think genuinely you gain the most from it 3rd year, just because you've actually got a little bit of background clinical knowledge. Whereas if I did this in 1st or 2nd year,
Yeah.
I wouldn't have a clue what's going on. Find this website wherever you live and see when they're open, and just get them in as soon as possible, because some of them close early because they get a lot of applicants. So maybe just write, they usually ask the same kind of questions: where you've worked, what's your history, and they might just ask, like, give me an example where you worked well in a team, or why do you want a placement at that trust. So for that question, try and tailor it to that trust. So do they have any specialisms?
And their values and stuff as well,
Their
as you would in an
yeah.
interview, yeah.
And so also just write down all the dates. And what I did is I made a little reminder. So I'd get a little reminder on the day that it opened. Then all I needed to do was that weekend make sure I go home and submit that application.
A lot of people during pre-reg, including myself, you can feel disheartened, incompetent, or like you're at the bottom of the ladder. How do you cope with overcoming that?
I think that's one of the hardest things about pre-reg. You are at the bottom of the food chain. Remember that all these places are quite big. Well, where we work, it's quite big, and they get pre-regs year in, year out. And sometimes the people who have worked there for ages be like, okay, sometimes it's like they get to know you, you get really friendly, and then you just go off somewhere and they don't really see you again.
It is easy to feel like, how do I matter in such a big picture? I think you have to just keep going, isn't it?
Yeah, definitely. You have to show them that you are keen. This is one of the things I was saying about being friendly with your tutor. You have to show that you are interested and you want to be a part of the team. So making more of an effort socially, being really friendly, make sure that they know your name. Yeah. So even if that's saying hi to somebody in the corridor, get to know them, like, what do they do outside of work?
Yeah. On a personal level as well.
Yeah, exactly, because that's what they get. pre-reg students all the time, but then they'll get to know you like, oh, this person went on holiday here somewhere. Just ask, get to know about their life.
Yeah, I think one thing as well that's important is to, as a pre-reg, remember all those times that you felt like crap, right? And make sure that you don't make anyone else feel that way.
Yeah, so be really nice. That's what
Just
I can
be
say.
a nice
be,
person
be,
at work.
Be nice. Just smile at people.
Yeah.
Never mind just people in pharmacy. When you're on the ward, just smile at the nurses. Just get to know the team.
Appreciate
get to know
other people
everyone
and the staff,
Yeah,
for sure. So, some tips on work ethic I think you could share, because both of us, I think we're hardworking people. Obviously, as pre-reg, I've noticed that you do put in the work, and you are proactive. And so, what's your advice? Because, you know, it's important to be a valuable member of the team. I don't think it's good for someone to be like, it doesn't make a difference whether she's there or not.
Yeah, I think when you first start, like I said, show that you're interested, ask questions, and be proactive. So if the phone is ringing, answer the phone. Like, just show that you are engaged. Use your initiative. Like, for instance, if it's a little bit quiet, maybe help somebody else with something. And I think then you become a really valued member of the team. You make a difference. You help out. You kind of move where you're needed. Learn how to label, because it could be short-staffed one day, or it's lunchtime and you need to cover. Then at least you can kind of
move between where you're
exactly.
You want to be able to be like almost like a one-man band, you know?
Yeah, you want to be efficient and good at all the different roles. And that just prepares you for being a real life pharmacist. You don't know when you're going to be short-staffed. If you can do all the roles,
it's all good for on-call as well.
Because you're going to need to know all these things, and you're going to have to do it eventually. So why not do it when you're a pre-reg, when you're new and you've got people willing to help you?
And the final question is, there can sometimes be, although I haven't seen it with you guys, but in terms of other places, I've heard a lot about like competitiveness between pre-reggers, or like that horrible sense of doom feeling where you're like, someone's got a job but I don't, and all that. How do you deal with competitiveness? Not that there's any between you lot, but I think we could give some general advice about that.
Yeah, so I feel like I've been so lucky. The pre-reggers at the trust that we work in are great. We get along really well, but I have heard these kind of stories from previous years or different trusts. Like, it happens, it's really common. I think the most important thing is that you focus on yourself. So your rate of revision, for instance, or your evidences are going to be different. They're going to be tailored to you, tailored to your tutor. And it's okay if it's not at the same level as somebody else's, because that's your level. So it's really important that you just do you.
Exactly. Keep at your own pace and ignore. There's so much noise. Just ignore it all. And what we said earlier on while we were having brunch was that the end goal right now is to pass the exam. So I know that some of you might have jobs at this stage and some of you don't. But if you don't pass, what use is that job offer, right? So ignore the noise and just focus on your goal, your pace, what you can do, and then the rest will, I think, fall into place, I think.
So I think it's really important that this is what happens when you have a group of pre-reggers actually come together, support each other. If one of you finds like a really good resource, like we always post it on our WhatsApp group. So in that sense, if you work together, you're all going to sit the same exam and you all want to pass.
And you all can pass as well.
It's not a bad thing if like, there's too many people passing. That doesn't happen.
Yeah, it's not as if only half of you can pass and half of you can't.
Yeah, like
all of you can pass.
Yeah, you should always be supporting your colleagues, and they're your friends as well. You spend a whole year with them, and you just want to make sure that you're all in a really good place.
Great, so that was it. Thanks for the questions on Instagram, but also if you have any more, I will send them your way and we could answer them. Thanks to Bunsey for featuring.
Thanks for having me.
Pre-Reg. And if you've got any more questions or anything, then let us know in the comments below, and I'll see you in the next video.
What's the question again? I completely forgot.
We're so cute.
Oh god.
No, I think we could have a better thumbnail.